Welcome back. You're listening to the discussion Innovation in Government, sponsored by Carasoft on Federal News Network. I'm your host, Jason Miller. My guest today is Jonathan Albaum, the Federal Technology Officer for ServiceNow. Now, Jonathan, before break, we were talking about returning to work, and you brought up this idea of you got to understand what people's needs are. You have to understand where your PPEs are. You have to understand all these pieces and parts that will make return to work better, easier. And you at the very end, you mentioned the dashboard. We all love a good dashboard, of course. But part of this is to collect that data, and we'll get to the data discussion in a little bit later on the show. But there's this idea of automation. How much can you automate? If you need to move PPEs from point A to point B, can automatically do that in some way, or at least make the alert that says someone's running short, send them. Walk me through how automation and the platform can help agencies.
Sure. I think that the idea of being able to make data actionable is, one of the most powerful ideas that, we can, that can come out of COVID. And, for a company like ServiceNow, we think a lot about our ServiceNow platform as the core to our company and core to our, business in the federal government. And to the extent that there's data, whether it's in ServiceNow or it's in, any of the other systems of record that support bringing people back into the office or other business processes in an agency, understanding the data is very important, and being able to see it is very important. But being able to take action, I think, is really most important. And to the extent that those actions can be automated, that they are workflows that can occur based on how data looks, well, now we have the ability to be very effective in our response to COVID or some other kind of event inside our agency. And when we were talking about different aspects of returning into the office, one thing that we also track is vaccine status. So as employees are vaccinated, there's a self-reporting capability that an organization can use to have employees report on whether or not they have received a vaccine. And to the extent that, the vaccine status has some significance into whether or not someone can return into an office, or maybe whether they can travel, or the kind of work they can do, we can assign work in an automated way based on that vaccine status, or we can send someone to a particular location based on that. And being able to do that in an automated way, as opposed to relying on someone looking through spreadsheets or reading through emails, creates a great opportunity for better productivity in an office. And to the extent that an agency can leverage the Now platform to make data actionable around COVID, they can do it around many other kinds of requirements that they have in their agency.
The vaccine discussion is interesting because a lot of agencies, it's unclear whether agencies are going to provide the vaccinations. An agency like DoD, for instance, they're vaccinating their service members. VA is doing a lot of vaccinations of their healthcare workers. But other agencies, pick on Commerce or pick on your old agency, USDA. It's unclear right now whether or not they're going to be supporting in some way. But eventually, as more of us get the vaccines, it's going to go. It means, okay, do you feel comfortable coming back to work? You have to know that information. Do agencies understand that getting that out of the spreadsheets, getting that out of emails will make their lives easier? Do they have that? Are they grasping that concept?
I think they do. I think people recognize that the way we've worked traditionally, emails and spreadsheets, the unstructured collaboration, it's very limiting, especially in a mode where we're disconnected. So I think there's just a general understanding that we need digital workflows in our agencies to make our missions work. And if we just can focus on vaccine administration management concepts, it makes it really clear. COVID vaccine management, I think, is the workflow challenge of our lifetime. When you just think about the complexity of the number of entities involved on the private sector, the companies that make the vaccine, the companies that ship the vaccine, the companies that make the equipment that's used to deliver a vaccine, let alone the number of federal agencies involved and state and local entities involved. There are so many players. Being able to coordinate across all of those different entities is really, really hard. And if we want to make sure that the vaccine distribution is very effective and it's very equitable, we need to really think about vaccine delivery as a workflow. It's a process with some very clear steps. And it's not just one workflow, but it's a lot of these across all these different levels. So when you think about it in those terms, whether you're delivering a vaccine to a population in your agency or in your your locality, if you're a government, or if you're working across governments, perhaps, you see how hard it is. And I think that makes a very clear recognition that digital technologies are really critical to make this successful.
You bring up a very interesting point about the workflow management of the vaccinations, getting the vaccines out, a workflow management challenge of a lifetime. And we sometimes forget that the pieces that have to come together, the private sector, the state and local, the federal, is this something that agencies are starting to try to be at the center of, and they're using a platform such as ServiceNow to connect the dots, if you will?
Well, ServiceNow is I think excellently positioned to be the platform of platforms for vaccine administration management across all levels of government. Our platform has a great ability to connect disparate data sets and be able to leverage that data through workflow to drive an outcome. In this case, getting someone vaccinated. So I think we're, in some respects, we're still adjusting to some changes that have come with the new administration. President Biden has been very clear that the federal government is going to play a leading role in distributing and administering vaccines. And that's been something of a change from the Trump administration. They had a different strategy. So when we think about the idea of 100 million vaccinations or 150 million vaccinations in 100 days, and you see how he's employing FEMA and the National Guard to perhaps deliver vaccines, mobile vaccination centers. If you read the COVID plan, it makes it clear that other federal agencies like USDA or the VA or maybe even Public Health Commission Corps will get involved. And now you can start again to see the complexity as we adjust to a different way of thinking about these sets of workflows. The federal agencies that are involved, I think, all recognize that there's a need for digital technologies that can manage the complexity and the workflows. Because in the end, we're trying to get people who need a vaccine, a vaccination, so they can be safe and healthy, and we can get back to some sense of normalcy. It's a really big challenge with national, international implications. You can't do that in spreadsheets. It's too complex to manage through email. So we're all adjusting to some of these new requirements. And from what I see, talking to a number of these agencies, there's a clear recognition that we have to take a different approach.
You brought this up earlier, and we've talked about, you've hinted at it a couple of times, but really what we're talking about here is this is just another big data problem. Understanding what data you have. You mentioned at the very beginning of this segment where it exists, how to use it, but this is also understanding what data is valuable and when it's valuable. How can agencies use a platform such as ServiceNow or many others, I guess, that could help them kind of make those decisions? You mentioned the dashboard as another example.
Yeah, Jason, I think that the reality is whatever the technologies are in an organization today, there needs to be a way to bring that data together, understand it, and then take action. We talked before about making data actionable, and that's really something I think ServiceNow is very well positioned to do. ServiceNow oftentimes inside an agency sits on top of a collection of other systems, systems of record, legacy systems, call them what you will, but there's really critical information in those systems. But too often it's disconnected from other critical data that when it's combined together, you understand what to do. And we've had some good success in the government where we've brought data together, and we have data lakes, and we have data tools that have given us very good dashboarding capabilities. And I think the federal data strategy is been a nice driver for some of these things. But there's still this very manual step at times of let me understand and interpret the data, then take action on it. And by the time I take that action, maybe the data's changed. I think we're talking about something very different here, which is let's do our best to understand the data and very quickly and at scale begin to take actions in an automated way, using something like the ServiceNow platform to automate the workflows that need to take place based on what the data is telling us.
One of the things is the making data actionable. During the pandemic, were agencies better about doing that? Do you get a sense that they were able to take the data of who was working, where they were working, what their mission areas were? Were they able to kind of ramp up along with the VPNs and the network access and all the laptops? Was data another area of the pandemic that was also saw a big increase?
I think data has been one of the reasons we've been as successful as we have been in terms of our response so far. And we've made a lot of progress understanding the situation and also being better prepared for the next disaster that might occur. We've also had a lot of good success sharing data with the public and accepting data sets from other entities so we can have the best picture possible of the current situation. So there's lots of stories at different levels of government where data's been part of the driver of decision making. I think we had these skills developing in the federal government. If you look back on the progression of our chief data officers in the federal government, we can see how they've evolved. They've moved from this idea of let's think about our data that we can share through something like data.gov to creating very focused data repositories like healthdata.gov, or moving into more data-driven decision making over the last few years. And I think that, again, the federal data strategy has a lot to do with it. I think the laws around evidence-based policymaking have had a lot to do. We've been building these skills. I think we're very fortunate that we've been building these skills because we have them now during COVID, just like we've been very fortunate that we've been investing in IT modernization and digital transformation. So when the pandemic hit, we had the opportunity to pivot quickly in the government.
Jonathan, we are just about out of time, so I'm going to give you about 30 seconds and ask you, what's the big takeaway from our conversation today? Agencies, as they're starting to really consider bringing back employees to work, what should they keep in mind?
So I think, one part is this idea of being able to get your employees vaccinated. So being able to distribute and administer vaccines, be able to monitor outcomes, that is core to getting back to a sense of normal. And then as we bring employees back into the office, understanding the vaccination status, making sure we have PPE and physical distancing as appropriate in our buildings, I think is really important as well. Those are examples of sort of core digital transformation requirements that I think are very clear to people now. We have to be able to give our employees great experiences under any circumstances. We need to be able to provide, customer service, at a very high level under any circumstances. And, they are very connected digital workflows, I think, make a big difference. The ability to optimize our IT infrastructure and drive, cost savings and flexibility and agility so we can respond to crises like COVID-19, because there will be another one, obviously is very important. And then from a mission perspective, being able to implement new requirements like we saw come through the CARES Act and do it in a way that creates a long-term stability and ability to continue to operate under any circumstances. We don't want to lose productivity because we have some kind of crisis. We want to be able to understand what's happening, leverage the technologies in our environment, and be able to move very quickly to create applications where we need them, to understand our data, and to drive great mission outcomes. In the end, I think people remember the experience that they have with the government. And if they have a good experience, their trust and their faith in government goes up a little bit. And if we can all do that, we can really restore the way people think about their government, how they engage with it. And I think information technology, data, digital transformation, IT modernization. These ideas, we talk about them all the time, because they're our jobs, but I think they can have a really huge impact on our nation.
All right, very good. There's more to talk to, but that's all the time we have for today. So let me thank my guest. Jonathan Albaum is the Federal Chief Technology Officer at ServiceNow. Jonathan, always a pleasure to catch up.
Thank you, Jason. It's great to be here.
I'm Jason Miller, and you've been listening to the discussion Innovation in Government, sponsored by Carahsoft on Federal News Network. For more on this discussion, visit federalnewsnetwork.com and search innovation.